So just to sort of, well, to start with really, I've split it into sort of 2 points. There's actually a third point I want to go on to really as well, but that'll sort of become evident hopefully. So to talk about managing side effects really, so I had a little think about this, and Frank very kindly gave me some information that came out of the last CLLSA conference as well. So I've used some of the points that people brought up in that as well to try and inform this talk and tackle some of the things that maybe came up there. This will seem like a really obvious thing to put in, taking treatment as directed, but I guess, and this refers more to, I guess, when you're taking chemotherapy tablets. So, for example, I will talk to someone and say, right, there's 2 types of tablets you're going to take. Say it's RFC chemo. You take them all at the same time, take them every day at the same time that you take them all together kind of thing. So there's one of my colleagues talks about a study where you think that you're telling everyone how to take tablets and everyone goes away and does as it says, but obviously everyone has different interpretations of that. So things like chemotherapy are important because they're designed to be given as a bolus dose. So although it seems a lot, taking 10 tablets in one go, that's how they're supposed to be done. And things like taking them every day at the same time are important because if you shorten that 24-hour gap between doses, potentially you can make yourself feel more sickly just because you haven't allowed that requisite time between the doses. So although it seems like an obvious thing, it's a very sensible point to kind of start with, really. And things like supportive medicines as well. Whenever you're spoken to and told about what treatment you're going to have, there'll be a raft of drugs that come alongside the other drugs to counteract the side effects. And obviously, mainly we're talking about things like anti-sickness medication and often things like antibiotics to stop you picking up infections while you're on treatment and your immune system's more effective. So again, it's about taking those as it says and allowing the requisite time between doses, as well as taking things on empty stomachs that need empty stomachs, all the sort of usual things that need to be done. I think this is quite an important point as well. So keeping yourself really well hydrated, it can't be underestimated really. And some of us are guilty of not drinking enough fluid a lot of the time. So we say this 2 to 3 litres, and it can include water, it can include tea, whatever it is that you normally drink. I get a lot of questions about whether you can drink alcohol on treatment. It's always the question, it always comes up as a kind of throwaway question, but it always comes up. So what I always say is there's no restriction on alcohol, but it's sensible not to have it the day before, the days of, the day after, and that's only because you don't want to dehydrate yourself, and that's what alcohol does. Otherwise, I think, you know, it's within sensible limits, as everyone advises. In between, I think that's fine. I've put seeking advice in quickly as well, because we all have this habit, and we all do it throughout our lives as well. If you don't feel well, you take yourself to bed, you see how you are the next day. And I always say to my patients, if you remember nothing else, this bit is the most important thing. Just if you're not well, you get on the phone, especially if you get a temperature, especially if you're on treatment and you get a temperature. It's a good sign or a common sign that you've got an infection, and these things need jumping on and acting on quickly. So it's about taking your symptoms seriously and not ignoring things and seeking the right sort of help. And not suffering as well, because obviously it's easy for us to say, right, these are your tablets, these are your anti-sickness tablets, these are if you get constipation, all the variety of things that we'll give. But if they're not working, or you still don't feel right, then it's important that you let us know and you get on the phone, and you should be given 24-hour contact numbers for people you can ring and ask advice from. And they're there to be used. They're not there to be put away and never taken out again. They're there because we want to know, we want to help if things aren't right. So it's important not to sort of suffer or wait till the next clinic appointment. It's important to just take advice as and when you need it. And about pacing yourself as well, because certainly with the more standard chemotherapy treatments, I guess I'm speaking more to those and things like the ibrutinib, the adalimumab, the venetoclax, the newer drugs which have a much kinder side effect profile. It's about listening to your body. So if you're tired, you rest. Don't commit yourself to doing lots of things at the point in the cycle of treatment when you know you're going to be tired and you know you're not going to have as much energy. It's important to put yourself first and not commit to things that you know you're not going to be able to do. And eating well, so eating reasonable meals, so you need a healthy diet, enough roughage but not too much. You don't want to cause constipation or diarrhoea. So it's important to sort of keep that in mind and not to overface yourself, so sort of small meals as and when you can eat them. Certainly with the chemotherapy that we use, there probably are going to be days when you don't feel like eating or your appetite isn't as good, and that might be just because the taste changes from the drugs, and it might be because you feel a little bit sickly. And it's important not to beat yourself up too much about that. If there's days when you can't eat, that's fine, because you'll make up for it on the days that you can. As long as you're hydrated, that's probably the most important thing, and not to be worried too much about the days that you don't eat. And reasonable precautions against infection. So again, this is sensible things. So again, we tell people, so If you are living with a partner who has a cold, it's important they try and do their best not to pass it on as much as you can. So separate towels, good hand hygiene, all those sort of things that we would all sensibly do. And not having people that come to visit you who've obviously got coughs, colds, who've had stomach infections in the last 48 hours, all the sort of sensible things really. And where possible, not mixing with lots and lots of people. So things like football matches or theatres, anywhere that's going to be really crowded. Ideally, it's sensible to avoid, certainly at the times when you think you're going to be most vulnerable. But that said, treatment can be 6 months or more, and you can't go and hide under a rock and do nothing for that time. You need to be able to get out and do things. So it's about sort of being sensible and taking precautions that you can take as well. I put this point in really because I think this is quite important, because I think how you feel, or sort of how you interpret how you feel the side effects, depends on how well you are when you start treatment. So if you are somebody that's got a lot of night sweats or you're very tired, and the treatment actually does carry some side effects, but you know what, you feel better than you did 4 weeks ago, that's a much easier experience as somebody who actually feels really well, has none of the B symptoms at all, and we're actually making quite sickly with the treatment. So that can be a harder thing psychologically, I think, to get your head round, that you're having to be made sick to be well, when actually you didn't really feel sick in the first place. So I think sometimes you have to bear that in mind, sort of where you're coming from when you sort of start treatment as well. And I put this in as well, because this is true, there are no stupid questions. If you've thought of it as a question, somebody else will have asked it along the way. I've been a nurse for 20 years now, but as time's gone on, my window of knowledge has gone right down to a very sort of small area, really. So if I go to another speciality, I'll have all sorts of questions that are probably really daft, but I will ask them because I know I don't know the answers and it's not my area. So there's nothing that's silly to ask, because we don't all know everything about everything, and nobody expects that to be the case. The things I sort of neglected to put in here as well, which is another important thing, is side effects. We give you a list as long as your arm of side effects for drugs. And if you open the paracetamol box, it's got a list as long as your arm that ends in death if you take too many paracetamol. So all drugs, you have to think, well, there is this huge list, but you know what? You probably only get 2 or 3 of the side effects, and we'll be able to talk you through what the most common things are and what to expect. But certainly nobody ever gets lots of side effects. And working in the job that I do with the clinical trials, a lot of the trials leaflets have got an overwhelming amount of information about drug side effects that can make it quite off-putting. But as I said, most times it's 1 or 2 things that really come up. And then moving on to sort of looking after yourself. So again, some of these are obvious things, and some of these will be things that are quite familiar to people in the room as well. So I've put immunoglobulin deficiency, because I guess this is something that will come up with certain people. So Prof will obviously explain this better than I can, but if you have your immunoglobulin profile tested, if you're getting lots of infections, so at the Royal we say if you're getting maybe 3 infections that need antibiotics in a 6-month period, it's worth having this check, because very often with CLL this can run low, and things like your IgG can be topped up with an infusion in the day ward, which some people in the room I know will have and other people may be familiar with. So it's a very easy thing to do, sort of keep your immune system as safe as it can be. I think probiotics are a really good idea. I know not everyone maybe would necessarily agree with that, and we'd be very careful if somebody's on chemotherapy to say you should be careful about what you're taking, because you don't want to necessarily upset and add things into the gut that you wouldn't normally take. But certainly after chemotherapy, after antibiotics, when you're going on holiday, I think they're an excellent way of trying to just keep your body that bit more safe. And supportive others as well. Linda will obviously talk more about the psychological side of things, but it's important not to do this on your own. I know that's not to say that people can't be independent and that you can't do a lot of things on your own. And obviously, at the end of the day, everyone goes, to a certain extent, everyone goes through things on their own, you know, really. But you need people around you that can support and that can come with you to consultations, that can take in the information as well. I've put diet and exercise in as well, just because these are things that are important for all of us, really. And things like exercise, even if it's just having a walk in the park and getting outside in the sun on a nice day, things like that can't really be underestimated for your mental health as well as your physical health. And keeping busy, so maintaining your life, maintaining the routines you did before within reason. There's really no reason why you can't carry on doing what you need to do, and keeping yourself busy and not giving yourself too much time, I guess, to dwell on things. And making plans as well, so same sort of thing really, keeping yourself busy, spending time with friends, doing the things that you would normally do to have things to look forward to and make plans. And I know sometimes it's hard because you plan holidays and treatment can get in the way of that, or things happen that mean they can't go and they have to be changed, but I think it's still important to have things to look forward to in the future. I've put this in as well about staying well, because obviously people don't just get CLL. You might have something wrong with your heart, you might have blood pressure problems, you might have diabetes. It's important, I think, to bear those other issues in mind, and where possible to just look after yourself in other ways. So to make sure that you're well, if and when you do need treatment, it's a good idea that your diabetes is under control or your blood pressure is managed and there's nothing else going on that might make that more complicated than it needs to be. And again, I think Pross spoke to this morning as well, really. It's about having as much knowledge as you need, really. Some people want a wealth of knowledge and need to know the ins and outs of everything, and other people don't need so much knowledge. They need what they need. So whatever you need to be in control, or to feel in control of what your disease is, that's important for you to have, I think. And whatever regular blood tests and checkups flexible to suit you. So again, Prof touched on this morning, but this will depend whereabouts you are on that journey, really. And I think it should be an open discussion with your specialist as to what you really need and when you need to be sort of monitored and what fits in with both of you, really. Again, Linda will probably pick up complementary therapies, but I've put that in there because these things are important as well. Medicine isn't just what is dictated to by your conventional medicine as well. Things like acupuncture and massage, there's a whole range of things out there that make a difference to people. Support associations, obviously, a lot of those are represented in the room today, and obviously we're part of one in the meeting that we're going to today. That they can't be underestimated, and I think they should be, as Frank's put that or alluded to that list this morning of the websites that are useful. These are the people you should be seeking information. It's very easy to go on Google and look up all kinds of things, get all sorts of weird and wonderful answers, but they're not the answers that you really need. You need to be sort of relying on the trusted sites, really. And second opinions, this has come up in conversation this morning really already, but I think you shouldn't be afraid to ask for a second opinion, and you shouldn't feel guilty about asking for a second opinion. If you don't think you're getting what you need, if you listen to the talks today and you think, well, I'm not getting that where I am, you go to your GP, you ask them to write a letter to somewhere nearby that specialises in CLL. Everyone's entitled to that right, and you shouldn't feel guilty about doing it. And about staying positive as well. This is a disease that's got an overwhelming amount of research, huge amount of treatments that work really well. So I think it's something that you need bearing in mind as well at the end of the day. I just want to flick through a few of these really. So this kind of came out of the list that Frank gave me. So there's a list from the last meeting that talks about whether certain things are valuable and have sort of merit in sort of keeping you well and stopping cancer advancing really. So I've just put a few slides in about this really now. So we all need vitamin C. There's some talk about whether high dose vitamin C makes a difference to CLL and other cancers. We get it from our diet, we don't store it. We need it for healthy cells and iron absorption. It's an antioxidant even, so it protects us against the free radicals. There's possibly some benefit in decreasing risk of colds, although it's a bit sort of grey area as to how much that helps really. Wrinkles, I think that's quite important, so that's in there as well. And gout, which is maybe less so important, certainly for me anyway. You need 40 milligrams a day. Average person takes 80 in a normal diet. So if your diet's full of processed food and you're smoking like a chimney, then that's the only time you probably need to take a vitamin C supplement. Because if you take too much, it can upset your stomach, and you're just going to pass it out of the body anyway. So really, there's not really any benefit to putting for any of us to take a high sort of vitamin C diet, because all you're going to do is pass it out of the body. The body takes what it needs and gets rid of the rest, so it's of no benefit whatsoever. Vitamin D has probably been in the news a bit more recently. So as most people know, we all need vitamin D for healthy bones. It helps us to absorb calcium for the same reason. It's needed for cell growth, for the immune system, and decreasing inflammation. There's some implication in maintaining blood pressure, and it may help prevent colon, prostate and breast cancer. So there is some sort of work around those things really. So that sounds quite good really, sounds quite important. We need 10 micrograms daily, 10 micrograms daily even, and certainly in the country that we live in, we probably should be taking a supplement in autumn, winter time, because we don't really get enough from our diet. It's not in very many foods, and we only really get it when the sun strikes our skin and causes that synthesis to happen. So again, as I said, this has probably been in the news a bit more of late really. So it can be really simply checked with a blood test. So this is something any of us could ask our GP to do, or our hospital specialist just to check it. It's important not to take too much in, because again it has an implication on heart and kidney damage. Now there's not massively overwhelming evidence to support it reducing all cancers, but it sounds like, certainly from what you read anyway and what I would think, I think vitamin D is probably a sensible thing to make sure you've got a normal level of vitamin D. So that's probably something we could look at. There's three others that are sort of less common really. So this thing called beta-glucan therapy, which is not, I guess I hadn't heard a lot about it really, so I sort of looked it up after the notes from the last meeting. Something from bacterial and fungal cell walls that's implicated in the initiation of an immune response. Has been used as an injection to attempt to extend life in advanced cancer, but there is no clear evidence that it works. So this is something that we probably shouldn't be exploring at all. Green tea, again, this is something that comes up quite a lot, and again, you hear a lot about the health benefits of green tea here and there. So it has got more antioxidants than other teas. It's got a whole range of things that it's supposed to help with, from cancer to tooth decay to Alzheimer's. There is a study from a couple of years ago that's used a compound from green tea and Herceptin for stomach and breast cancers, and it's supposed to be coming into sort of human trials at some point. And it's certainly not harmful. So there's certainly no harm in drinking green tea or having green tea as part of your diet. Whether it actually has got a long-term benefit, I suppose, remains to be seen, really. And turmeric as well is the other one that I really looked at. So again, this is used in, it's been used for thousands of years in Ayurvedic medicine, and for, again, a number of things, from heartburn to ringworm. I don't quite know how they know that, but anyway, that's in there. There has been a study a few years ago that found it, certainly in the lab, it can kill cancer cells. And it may help with prevention of lots of different things. So I take turmeric, but I take it for a digestive reason. I've took it for a long time, and I find it really helps me. So I guess it depends. A lot of these things come down to sort of personal choice in the end. You read the information, you choose whether or not you think that they might help. And that's my last slide, really. So if anyone's got any questions for me personally, or whether you want me to wait till the end, Frank, I'm not sure.